sector this morning. First up, I'm going to ask the Minister herself to please come through so that we are able to start the media briefing. She will read a statement first, and thereafter we'll have two presentations. Minister, thank you so much.
Good morning, and thank you very much for joining us. I really wish to start by condemning all acts of gender-based violence that were perpetrated against women and children. The most recent incidents of violence meted against women and children are indeed very disturbing and marrow-chilling. The murder and mutilation of the fourth-year student at the University of Fort Hare, Mthembeni, the assassination of the CFO from the Gauteng Department of Health, Upapita Diokran, the gang rape of 11-year-old in Motshekga in Limpopo, the grade 1 learner who was raped at her school in Soshanguve, and all these, let's just say, are very sad incidents were still committed during the month when we want to celebrate women. I also wish to implore all law-abiding citizens to deplore such monstrous crimes, but allow the arm of law to take its course. I wish to really say, let's all speak against gender-based violence everywhere it shows its ugly head. Let us act against it using all the platforms available to us. So as we come to the end of August month, the Women's Month, we must continue to advocate for harmony, understanding, and cooperation as a society, men and women in a democratic country. This week, we released the results of the 2021 May-June examinations. I wish to report that these exams were successfully administered at the height of COVID-19, in fact, the height of COVID infections during the months of May and June. Both candidates for COVID-19 symptoms, they were separated and wrote at different venues. The results of its exams, unfortunately, we can't release them the way we release the other results. But I wish to report that a significant number of learners this year passed very well the gateway subjects. We had 11,557 passes in maths, and we had 8,258 learners also who passed physical science. The results for these exams are available on our website, www.education.gov.za. Again, I want to take this opportunity to report also that on Thursday, the 26th of August this year, 2021, we did launch the Early Childhood Development National Census. This is an important step in the ECD function shift which is taking place between the Department of Social Development and Education. The first of its kind ECD National Census will highlight opportunities to broaden the access to quality learning for every South African child. The ECD National Census 2021 data and indicators will also establish a baseline for assessing the quality of learning through play in South Africa. A key barrier to effective planning in the ECD sector has been the lack of accurate information on ECD programs and data systems. There is a limited accurate information on ECD at the present moment. So the information that we are gathering will be used to integrate ECD into the DBE's education information systems and thus expand the provision of education support programs as well as play-based learning. This program has been funded by the Legal Foundation. Data indicators will also establish a baseline for assessing the quality of learning through play in South Africa. We really want to request all registered and unregistered EC centers to participate in the national census, as this will broaden the access to quality learning for every South African child. So we therefore appeal to all ECD sites owners and practitioners to open their doors to field workers for the successful execution of the ECD national census. In many instances, we need ECD centers to proactively volunteer their details to participate in the ECD census 2021. On teenage pregnancy, ladies and gentlemen, there is one matter that we cannot ignore as a nation, including us as a department, because it impacts negatively on the work we do as a sector, on the lives of the young women and their future. We are concerned about the alarming rate of teenage pregnancies in our country. Let us be clear that it is not just a problem of Gauteng, it is a national crisis. Most of these teenagers are of school-going age. It is a serious indictment on all of us as a society, and we really need to reflect deeply on this crisis and take urgent action to arrest the moral decay. Early and unwanted pregnancy perpetuates poverty, and it disrupts the growth and development of our young people. It also contributes to worrying dropout rate that we are fighting so hard to reduce. It has become even more urgent that as a nation we act together collaboratively on this matter, as it threatens the future of the country. For its part, the Department of Basic Education and its stakeholders, we commit ourselves to intensify the implementation of the comprehensive sexuality education program, which aims to empower young people with age-appropriate information. We will need once again to mobilize our communities and stakeholders to unite against this scourge. The time has come to bury our differences with the religious sector, the traditional leadership, and parents really who had not even read the material but were hoodwinked in disinformation around the program that we are successfully running with other parents. And also guardians who were opposed to the comprehensive sexuality education as one of the weapons we can use to educate and enlighten our children around unintended and unwanted pregnancies. Again, Chair, on the return of primary school learners, you will recall that when the third term resumed on the 26th of July, and we had said we want to see all learners coming back, especially in the foundation phase, coming back on the 2nd of August. We also saw the return of the majority of primary learners to full attendance, while other schools were honestly unable to include all learners in all grades to come back to classes. We're working with provinces to create more spaces that indeed we ensure that all learners in primary schools are fully accommodated and can return to classes. We did allow other schools, after asking for permission, that they are not able to do it still within the health protocols. But we wish to indicate that social distancing requirements, they continue to remain a challenge in our schools. We continue to work with the Department of Health and our stakeholders to explore solutions in this regard. No one can deny the resurgence of COVID cases in isolated parts of the country which affect our schools. For instance, we had high resurgence of COVID-19 infections in Phoenix, in Umlazi, in KwaZulu-Natal, in Muteo, in the Free State. We also saw high resurgence in the Western Cape, and particularly also in KZN. Other than this, the system health continues to remain stable and functional despite persisting learning losses attributed to the COVID-19 pandemic. We must report we're extremely concerned about the learning losses observed within the sector, and that's why I had invited researchers from the department to also enlighten the nation about this serious matter of learning and teaching losses that we're experiencing in the sector. Of particular concern are the learning losses reported across the system since the emergence of COVID-19 pandemic in 2020. The unpredicted closure of schools and the unplanned disruptions to teaching and learning, they have resulted in the reversal of gains made in the last 20 years. And unfortunately, research indicates that lost school days lead to foregone learning. Our international experience and research confirm that learning losses experienced during pandemics lead to long-term adverse effects, including learners obtaining lower overall education value and ultimately lower lifetime earnings. Thankfully, we've now begun to measure COVID-19 related learning losses in a local context by comparing how much learning children learned in 2020 with how much they have learned in an average school year before that. These measures indicate, again, worrying results which you will receive later. There's also evidence that comes also from our independent partners, like National Income Dynamic Study, which confirm this very disturbing trend which we'll be reporting to and that we want to speak to you about. And we believe that the first step towards addressing the crisis of lost learning, it is to prevent further disruptions to school time and prevent other learning losses. Experts keep on reminding us that children are less susceptible to COVID-19 infections. So our efforts to introduce comprehensive safety protocols in schools and the vaccination of teachers and support staff have created the possibility to keep schools open and sustain return to regular attendance. Now, and the second step now is to introduce measures to catch up on the time as well as the teaching and learning that we've lost through COVID-19 pandemic in particular. And that's where, again, we are calling upon our communities, societies, parents, caregivers to support as much as they can, because sometimes, as I say, we reach the limits of what we can do within the time allocated within the COVID-19 protocols. And therefore, we are reliant really more than before on communities and caregivers to support their children. So on vaccination, as a department, in collaboration with the Department of Health and Social Development, we continue to provide health services to learners in schools through an integrated school health program. For children to receive these services, government requires permission from parents and guardians in writing. There is a form which has been distributed to schools, which must be completed by parents and guardians to give consent for services to be rendered to learners. Of course, we are aware of the legal limitations of such consent, but it is critical for parents and guardians of our learners to allow the sector to provide these health services. The health services that I'm referring to include deworming, which we've been doing throughout years, and again, we need permission from parents before we can even begin with such programs. The routine immunization against measles, polio, and also the HPV, which is a cause of cervical cancer later in life, as well as checking for common health problems, health education, and indeed mental health and psychosocial support. On the day when these services are rendered, parents are free to come to school with their children to obtain more information. We wish to stress that there are currently no COVID-19 vaccines that are approved in the country for people under the age of 18. Program director have been really, I don't want to use the word harassed, but lobbied by students to say they want to be vaccinated. And I keep on repeating that there is currently no vaccine that has been approved. But even by the time it gets approval, as a sector, like all the other services I've mentioned before, parental consent is going to be critical. So it's not anything that we can do on our own without parents. But I want to take this opportunity to encourage all 18-year-olds in our schools to get vaccinated. So we will be running campaigns in our schools to make sure that learners who are 18 and above are encouraged to vaccinate. On the 2021 school calendar, we met as MECs on Friday, the 27th of August, to consider inputs from stakeholders following rounds of consultations. Because if you remember, when we lost a week in July, we had made a commitment that we will claw back the time by looking at other measures. One of the measures that we're looking at was to make sure that we don't have the October holidays. But after consultations, it was quite clear, and for very valid reasons, that we have to keep the calendar as it stands. So after consultations regarding the already amended school calendar for academic year, we wish to really say we had to finally agree and consider as MECs that we should keep the calendar as it stands. So which means we won't be using the October holidays to claw back on time, but we've looked on other days, 1 day there, 1 day there, to see if we can still get the 5 days back. But the long and short is the calendar is going to remain as easy. If parents had plans for the October holidays, they should continue their plans. So in conclusion, I really wish to ask our own local professor, Martin Gustafsson, to make a presentation focusing on learning losses, because that's what I really wanted this input to focus on, because basically we want to appeal to committees and caregivers to support us by supporting children at home. When we give them homeworks, please ensure that they complete those homeworks. When you give them tasks, support as much as you can. When we are on radio or on TV trying to make up for lost time, we're appealing again for committees to just give them space to listen to the radio. It won't take all the time, but also just to follow some of the programs that we're having as a sector to try and cover up and claw back on lost time. So that's why I've invited Professor Martin Gustafsson, but also asked Cheryl Weston, who's the Director for Curriculum, to also talk about curriculum coverage. And I think, without depressing you, you'll agree with me that there is a need to up the game, both from education, but mainly also we're reliant this time greatly on parents and caregivers to support children to stop the unraveling that we're beginning to experience in our schools. So Program Director, let me give way for Professor to make the presentation. Thank you very much.
Thank you, Minister, and morning to you, Director General, everyone here, and those listening to this remotely. So I will be reporting on some of the key pieces of evidence that is driving a lot of the decision making in the DBE. It's research that a number of people, South Africans and people from beyond South Africa, are involved in. So it might be good to just start with what are the slides visible? Okay, yeah. Right. Yes. You know, what the Minister has just referred to, the concerns that we have in South Africa are global concerns. This is not something that's just special to us. And I think it's useful to just have a look at the kinds of concerns that the United Nations Secretary General has brought up. And yeah, I mean, you can see them there. Education is the bedrock of development. COVID-19 has brought about the largest disruption that we've ever seen to schooling, and then highlighted in red there, a generational catastrophe is not an exaggeration. I'll show you evidence just now. This is not just about problems, consequences now, but consequences for our lifetime. So some of the key questions that we have to focus on are the following. So how much learning have we lost? Exactly how much? How do we know that? How does our situation compare globally? What are the longer term effects of these learning losses? What do we currently know about the effect of attendance and schools being open, classes being full or half full, on infections, which is a concern of a lot of people? And then finally, I mean, what is the current advice, for instance, from the World Health Organization on dealing with all of these multiple problems where we have to do a very difficult balancing act? So how much learning has been lost? in South Africa. The Minister referred to evidence that we have in South Africa, and here are the numbers, there are the reports. We obviously need to go through this kind of research work very carefully, and there has been very thorough work behind this type of monitoring. So there are some measures that are really good for gauging how learners are progressing through the system. And one of the measures that we had from even before the pandemic was this words correct per minute, where children are reading the same passage grade after grade to see whether they are reading better, how many words correct do they get. And this is one measure that we can use on to gauge how learners are progressing, in this case in literacy. And here we're drawing specifically from isiZulu data in Mpumalanga, and we saw that before the pandemic you had like 13 words correct per minute on a specific reading passage. That went up when the same children read this at the end of grade 3, it's up to 22 words. What happened with the pandemic? Well, it hardly went up. It went up to 24. Historical data suggests this should be 31. So in other words, reading progress for these particular learners kind of came to a halt in 2020. And if you look at those numbers, essentially it tells us that about 80% of what children should have learned in a year was lost. Of course, the same analysis can be applied to different subjects, different grades, and we can be certain that there are losses throughout the system. But what's particularly concerning are these losses at the foundation phase, because this is where fundamental skills are developed, which then serve learners for their entire schooling. Now, how much contact time has been lost? We know that on average in 2020, about 54% of the school year was lost. And that then raises the question, how is it possible for 80% of learning to be lost, of a year's learning to be lost, if we only lost 54% of the year with respect to time with teachers? And here what we need to remember is that with these disruptions, learning does not happen as it did before. There's also forgetting that happens. These disruptions have effects on learners that go beyond what one might think just looking at the time that learners have lost. Now, turning to the 2021 school year, approximately half of the school year has been lost for a very large number of learners. We have monitoring that tells us that the preferred approach across the system has been about 3 days per week of schooling. So children are losing 2 days per week in almost half of the system. And this has continued until recently. And of course, now there's this interest in normalizing attendance as far as possible, because this is really what lies behind these learning losses. If children are not in contact with teachers, especially children from disadvantaged communities, learning does not happen as it should. Now, we know that learning has been worst for the poor. We have data called the NITS-CRAM data that has been collecting information from households during the entire pandemic, and this tells us that attendance problems have been worst in rural and township schools. Eastern Cape and Free State appear to have had particularly serious losses in attendance, and we also know that poor learners are less likely to learn when they are at home, whether it's materials coming from the school, they just don't have the facilities to use that, or whether it's support from parents. I mean, obviously one must keep in mind that middle-class parents have often taken the initiative and supported learners in ways that in poorer communities, parents just don't have the resources, the know-how to do that for children. So this slide deals with the issue of, exactly how many children have we lost in 2021. And here there is some confusion. The NIDS-CRAM data, it's been in the media, has found that around about 500,000 learners who should normally have been in school are not in school. We're not sure exactly what to make of this evidence. One needs to keep in mind, and the analysts of this data acknowledge, that the data are very difficult to interpret. We're talking about data that's collected through phone calls to households in a context where children are not attending every day. So, non-attendance can be interpreted in different ways by the household. It's difficult data to use. But we obviously need to look very, very seriously at the question of what has the pandemic done to attendance. And there are various factors at play here. Households could be experiencing problems that mean that enrolling learners is not their first priority. There could be fears around the coronavirus that change enrollment patterns. Now, the DBE has looked at the enrollment data, and this research will be released soon. The findings are that, yes, there has been a problem, but it's not nearly as large as the 500,000 suggested by NIDS-CRAM. So what are the specific problems that we see? We see that young children who should be coming into school for the first time in grade R or grade 1 is lower than we would expect by about 25,000, which is a problem, but obviously not of the magnitude of the 500,000. Children aged 7 to 14 are appearing in schools in 2021 at slightly lower levels than we would expect. We have our estimates currently that we've lost about 10,000 learners of compulsory school-going age. Those are 10,000 young children we obviously need to worry about. We need to follow up. We need to make sure that these children don't lose out on schooling. As far as enrollments above grade age 15 are concerned, the situation seems to be less serious. And in fact, in grade 12, the data tell us that schools have been particularly accommodating in allowing grade 12 to repeat, given the difficulties that grade 12 learners had last year. So that's the situation then with regard to enrollment in 2021. How do we compare globally? Well, there you have three key figures from that compare South Africa to the rest of the world. Between the start of the pandemic and the middle of last month, in Africa, about 69% of a school year had been lost. Okay, that's over a period that's almost 1.5 years in total. 69% of a school year had been lost on average. Outside Africa, it's actually worse. So Africa has on the whole been more successful at keeping schools open. South Africa, we're sitting somewhere in between. And then turning to a very important ratio, this ratio of learning lost versus time lost. Now, in South Africa, the figures that I referred to earlier, the 80%, 54%, point to a ratio of about 1.5, which is very similar to what other countries have seen. And so, to put it simply, I mean, you can think of the fact that if a child loses a week of school time, the child has lost approximately 1.5 weeks of actual learning because of the way learning works, because of disruptions, because of forgetting. Likely longer-term effects. Globally, the World Bank has estimated that children who see their schooling disrupted as a result of the pandemic will see lifetime earnings on average that are 5% lower than would otherwise have been the case. Now that's an average. This would be a lot worse for some, especially those who lose a lot of schooling, drop out of school. So these are very serious long-term effects. Now, why would one get these long-term effects? Well, firstly, the sobering reality is that we've now reached a point where it's virtually impossible to recover the lost learning, all of the lost learning. So the challenge currently is to minimize the losses that have occurred. We're almost certainly not going to be able to get back to where we should be, or would have been had there been no pandemic. And we should, of course, keep in mind that learning is, and there's a lot of economic evidence for this, learning, especially learning at the early grades, is absolutely essential for all sorts of things. Earnings, women's empowerment over the longer term, and even small losses can have repercussions well into the future. Just to illustrate the point, we are concerned obviously about the matrics now, but we should be especially concerned about the matrics 10 years from now, because those are the matrics who will have suffered learning losses at this very, very critical foundational phase. Then the question of schooling and infections. Now here, and this is critical right now. It's an issue which people are obviously very emotive about. It's an issue that's quite difficult to analyze and research well. If there are no learners if there are no reported cases amongst learners in schools, obviously that doesn't mean that there have been no cases, that there have been no infections, they just haven't been picked up. At the same time, if we pick up learner cases in a school, this often leads to very deep concerns, which is justifiable, but does it mean that there would have been fewer infections if the learners had not been in school? Because learners are obviously interacting with other people outside school as well. So it's a potentially very confusing area. There's a good review from early this year of various studies, research studies that have been made around the world, and firstly, several of them use methods that are not really valid, but where they use valid methods, these studies don't actually point strongly in either direction. So they don't point to schools being kind of strong centers of transmission, nor do they point to schools being particularly effective at reducing transmissions relative to allowing learners to be at home. So the bottom line is that schooling, whether you close or open schools, it's actually quite a weak, what are called non-pharmaceutical intervention. It's a weak kind of restriction. It doesn't make a very large difference. In fact, if you look at the World Health Organization kind of priority lists for actions, closing businesses is regarded as more important than closing schools if you want to control transmissions. Right, I'm almost done. Now, we've looked at this question in the DBE using health data, daily cases by age, and the analysis that we've done agree with what we are seeing in these studies from beyond South Africa, that there's no clear evidence pointing either way. So schools having our children in schools does not, from the data, encourage transmissions, and conversely, keeping them at home does not increase transmissions either. But this is in a context where we have reduced class sizes. We've had these special attendance arrangements in schools. As we move forward, obviously we can't know exactly what the impact of of having more learners in schools will have on infections of children. We've not been there yet, so we cannot know this for sure. But what we do have is we have monitoring systems that can monitor this very, very closely and can pick up if there are any effects that require us to take special action. So the monitoring systems are there. And then my last slide. I think it's useful to look at something like this from the World Health Organization. How do we balance all these priorities and concerns? Childcare services in primary and secondary schools should remain open, says the World Health Organization, with adequate safety and surveillance measures, the kind of surveillance I was talking about, using data to see exactly what's happening, as long as the local context allows. Obviously, the context can vary across the country. It's often that the optimal thing is not to apply exactly the same strategy everywhere. Continuity of education for children, for their overall well-being, health and safety. Education impacts on the health of children and their health for the rest of their lives should be at the forefront of all relevant considerations and decisions. And then the last slide is just a list of some of the key pieces of research that we've used. Thank you, Minister. Thank you very much.
Good morning, Minister and DG, and good morning to all members of the press and members of the public who are joining us this morning. I will be sharing with you some of the findings of some of our oversight and monitoring visits that we have conducted, and also share with you how we plan to use some of the data that relates to curriculum coverage in our schools. Now, we all know that the pandemic has really disrupted schooling, not just in South Africa, but around the world. And with that disruptions, as we have heard this morning, we've lost significant amount of teaching time, and that in turn translates to a loss of learning time. So during 2020, as curriculum and in order to deal with the impact of the pandemic, we have significantly trimmed and adjusted our curriculum to align with the available time that teachers have, focusing on the fundamentals and core skills that learners need in order for them to progress in life. For example, in the senior phase last year saw us even reducing the number of subjects in order to create more time for teaching. We've also, in terms of assessment, reduced our end-of-year examinations, which we normally run at the end of the year, in terms of its scope, and scaled it down to control tests. All this as measures to ensure that we create time for teaching and learning. As part of our support program in 2020, we developed a 3-year curriculum plan, which include the development of annual teaching plans for all grades and subjects, which we implemented from the beginning of this year. However, this is a 3-year program, and therefore our monitoring focused on trying to understand the implementation of the 3-year recovery program, in particular keeping in mind the continuing impact of COVID-19 on teaching and learning, and therefore be able to better support teachers and as they implement our recovery program. Now, what we have found in terms of our monitoring, and we started at the end of towards the end of the second term, and we are continuing with this process even in the third term right now. We focus, like I said, largely on the implementation of our recovery program, what progress teachers are making in terms of curriculum coverage, and also we need to obtain this data in order for us to better support teachers going forward. Now, I we have visited thus far 4 provinces, and I'll just use one as an example, which is the Eastern Cape, where we had focused on 4 districts. We visited 35 schools and we focused on 11 subjects. This is not, and I must say that we sample schools very deliberately because we want to understand what is really happening in the worst or lowest performing schools in order for us to determine the type of support that is needed for our teachers and our learners. What we found was really a mixed bag. Overall, yes, there has been, COVID has severely impacted learning and teaching time. But to our surprise, we found that in terms of curriculum coverage, our teachers are making significant progress when it comes to covering the curriculum. If we look at the number of schools that we visited and what we found in that schools, it's really a mixed bag, with some schools really, to our surprise, even some schools being on par in terms of curriculum coverage, especially, and we focused in particular on grades 10, 11 and 12. In our grade 12 or grade 12, because they are at school every year, most of those learners or teachers are on par in terms of curriculum coverage or completing the curriculum. But as you go lower down, grade 11, grade 10, because they are still on rotational times in the majority of schools, which is where we are beginning to see greater learning losses. At the same time, what we found, because teachers, a number of schools are introducing, and really thank you to the parents and also continue to support the schools in such efforts, where they are creating additional teaching time, for example, on weekends, even in the afternoons, keeping learners longer at school in order to ensure that they stay on par or they get to complete the curriculum as best as they possibly can. Now, when we look at various subjects, like I said, there's a number of subjects that we have shared, and our findings is generally the same. In the interest of time, I won't stop at each and every one of them, but clearly just to say that the key findings in all of these subjects is that learning or teaching are progressing at a better than expected level, if I can say that. As much as it is not near where we should be, but it's progressing at a better than expected level. However, a key finding for us is that in terms of the learning that's taking place, there we are seeing very low levels of learning that has taken place. Teachers are prioritizing curriculum coverage, and therefore that means the focus is on teaching, and really our focus on learning is beginning to show to us that the learning losses, despite the teaching that is continuing, there's still a large number of learning losses that are continuing, as we saw in the previous presentation by Professor Gustafsson. In terms of the GET, which is our lower grades from grades R to 12, we are implementing curriculum trackers, and these trackers are particularly there to ensure that we guide teachers and provide clearer structure in terms of teaching and assessment. It's currently being implemented in 4 provinces. It really provides the teachers and subject advisors a record of work completed, and also it's serve as a handover to the subject teacher in the next grade to ensure that there's, as I've mentioned earlier, this is a 3-year recovery program. Therefore, we do not expect to be able to cover all the learning losses that we are experiencing this year. But what is critical is continuous monitoring in order to ensure that we are able to recover those losses as we move through our program. So therefore, our curriculum planners and trackers are implemented in the foundation phase, intermediate phase, and senior phase, focusing on a number of different subjects. For example, in the intermediate phase, we're focusing on mathematics, natural sciences, and technology, while in the senior phase, the focus for the trackers are on English additional language, or mathematics and natural science. These are all key subjects that will really give us a good sense of progress in the system in terms of curriculum coverage. We have trained subject advisors and teachers on the implementation of the curriculum trackers, and also provide very detailed material for teachers to ensure that we address the particular area of learning losses that have occurred, especially in our that is also occurring in our primary schools. So in really generally, our curriculum visits and monitoring, which is still ongoing, confirms the loss of teaching time, but the progress in terms of teaching is slightly greater than what we expected. It is not, I want to repeat, it's not near where we are supposed to be at this time because of COVID, the impact of rotational attendance on teaching and learning. Schools, we found a number of schools that are implementing innovative measures to create more teaching time for learners. Like I mentioned previously, for example, classes over weekends or in the mornings or even in the afternoons, and that stretches even in the lower grades where it's really needed. We also find that the focus on curriculum coverage really, or trying to stay on par with our annual teaching plans and the pressure that is created, that is creating for our teachers, is really not translating into our learners' learning. When we interrogate the evidence of learning, we really find a very almost no correlation between the teaching that has taken place and the learning that we are expecting. So our learning losses is really, really worrisome at this stage. We do plan to use this data that we collect in future, like I said, to really create better support for our teachers to ensure that within this 3-year or the continuum of 3 years, we are able to secure or recover as much as of the learning losses as is possible. Thank you very much.
Thank you so much, Minister. Thank you so much, Prof. Gustafsson, and thank you so much, Ms. Weston.
Can you give DG an opportunity, because we also have research from NECT on the matter, and saying they'll be going public on it.
All right. That's fine. DG, I'm going to ask you to come through to talk to the key points in that presentation. There's been a lot of work that has been done into the learning losses in the country. Different stakeholders in the sector have also done work, so we think that it should also be shared publicly. DJ, over to you.
DJ, I think the mic should be quite special.
Good morning. Thank you, Minister, and to the team of experts, Professor Gustafsson, Mrs. Weston, Dr. Similani, and Dr. Polia. The whole team is here this morning. It's a big team of curriculum driving the issue of curriculum coverage. And I want to also appreciate the opportunity that the Minister has given us to really get all of us, including the nation, to focus on the notion of curriculum coverage and to appreciate the fact that it's going to take all of us to get it done. We've never done this before. We have huge inequalities in our communities and our nation, which remain a risk for us to get this done. And Professor Gustafsson is right. All that we are doing is to mitigate against learning losses. And Mrs. Weston has really emphasized the disjuncture between what teachers have been able to do and the extent to which learners have been able to reciprocate that. That remains an area of concern for us. The National Education Collaboration Trust has done a lot of work around this area as well. Apart from their comprehensive reading program, I mean, everywhere I have been. Yesterday I was in Umkanyakute in KZN, monitoring the weekend learner support program. I mean, lots of things that the NECT is doing came out quite prominently in their presentations. And Mrs. Weston is right. Teachers and officials themselves are doing a lot. I'm extremely humbled. I never expected this level of sacrifice and commitment. I've never seen it before, that primary school learners go to school on a weekend. It always has been grade 12 learners. I've now seen even primary schools being called to school to learn during weekends. The NECT, apart from, making efforts to support the basic education sector in curriculum coverage, they've also done an assessment of curriculum coverage, and they've done extensive work. And all of these present amazing data that we've never had before. You have the needs cramps survey by Dr. Nix Paul, which has done wonderful work in this regard. We've got our own practitioners in the system under the leadership of Mrs. Weston and Dr. Semilani, who've done excellent work, gone out on a deep stick to give us a sense of what is happening in the system. And maybe lastly, what I want to say also is that apart from this wonderful work that really follow up on what is happening in the system, it's important to understand that we've moved what traditionally used to be informed curriculum coverage as the work that teachers have covered. It has now gone much broader and deeper than that. And some of the aspects relate to what the written work of learners is telling us, juxtaposing that with what teachers are indicating in their records that they have covered. And secondly, it's about the assessment element that brings both the teaching and how learners encounter what teachers have covered. So, which means that curriculum coverage, as we traditionally knew it, has really moved, has evolved quite comprehensively to involve a number of dimensions that would provide some comfort to us, that when we say that we've assessed curriculum coverage, these are the dimensions that have been covered. And on that note, Minister, I want to say we continue to move. For instance, this coming week I will be in the Eastern Cape, and we'll be covering all provinces to look at what has been covered, what are the gaps, and what exactly are we doing about the gaps. But as the Minister said, and Professor Gustafsson, this is work not only for 3 years, it's work that will transcend generations that we'll need to grapple with. Thank you very much.
Thank you so much, Minister. Thank you so much, DG. We will now take questions. As you will recall, there were 2 presentations plus the minister's statement. So there's a lot of information that is there. And we have shared this with you as the minister and the presenters were going through them, so that you have time to look at some of the issues that you'd like to get more information about. I'm going to ask that we go to the WhatsApp line first, Ignatius, and see if there's anything there that we can get from your side. Thank you.
Thank you, Mr. Motshekga. I just have a couple of questions from Suman Naidu, which is a freelance journalist. Says, as we know, this period for our matric learners is marked with great anxiety and stress for our learners. What is the department's message to matric learners? And then secondly, does the department support the idea that the department should use the COVID-19 pandemic as an opportunity to transform and update the curriculum and the education sector as a whole to keep up with the changing world? And she further says, as we enter September, we will mark Heritage Month. This as some learners express concerning allegations and incidents of racism across the country, accuse schools of prohibiting learners from speaking isiZulu official language? Can the minister clarify this? Can schools ban learners from speaking an official language? Is this legal? And will the department tell schools to stop harassing our black learners for growing their natural hair and strongly condemn them? Thank you, Mr. Chairman. That's the only question for now.
Okay, great stuff. Thank you so much. Can we come back to this room to see if there are any questions? I'm seeing 2 hands already. I'm going to start with you. Please introduce yourself so we can all know who you are. Thank you.
Good morning. Motshekga from ENCA. So we understand, Minister, from the briefing that clearly a lot of learning and teaching time has been lost. Can we call it a crisis at this point? When it comes to the infections in our schools, can you just have the overall numbers? Where are we in terms of infections when it comes to learners as well as teachers? And where is the department on, we know that of course some schools are back to a normal timetable, but when it comes to the spacing, I remember the department saying that they were reducing the spacing to more 25 meters. Is that still the case? Thank you.
All right. All right. Let's move to the second question.
Thank you. Good morning. Sakuma Ate from Newsroom Africa. It also just goes to what he has said, the issue of infections in schools. I mean, just in the Free State, the MEC there yesterday tweeted that 87 learners have tested positive, and these are primary school learners. Is there still the concern around, or, I mean, I heard the minister say that we have seen that there really isn't a huge impact of COVID-19 on learners, but here in the Free State we are seeing that there is quite an impact. What is going to happen should this continue in the schools, that more and more learners are getting are testing positive for COVID-19? And what message does the department then have to the various provinces around what the issue must be? I know that there's the risk-adjusted strategy, but what more can possibly be done by provinces to ensure that the schools in themselves are safe?
Thank you so much. That will be the first round. Minister, I'm going to ask that you handle it. Thank you.
No, thank you very much, Elijah. Just on the point that were made by Naidu on the message to grade 12 learners, it's the same that we're going through very difficult times, and unfortunately they are part of those difficult times. COVID-19 has come to be very depressing to most people, and our schools are trying all they can to give even psychosocial support, but it's to ask our children to remain strong, focused, and do the best that they can under the circumstances, because there's nothing I think we can all do. So really my message is that they must remain strong and focused. On whether COVID-19 has not helped us to transform, it's actually unfortunate that it found us during the 6th term. If you look at what we had hoped to achieve during the 6th term of administration, because if you look at the history of our education system, for a very long time we're struggling to stabilize the system, that we all have a clear understanding of what we're supposed to do. We stabilize the curriculum, we stabilize teacher development, and we had reached a stage as a sector where we felt the system was adequately stable. And we're beginning to introduce, because again, in education, you can't rush things, otherwise you're going to create problems. We began to introduce changes. The 3-stream curriculum, it's not an easy one, because we have to skill people, we have to give materials. We had gone into robotics, we had gone, really the 6th administration, we had hoped that we will be able to now move our system to the next level. which was very unfortunate. And really we had put all systems in place. We had sought funding. We had introduced quite a number of subjects. We're looking on skills of the future. Before COVID, we used to travel a lot, even to compare, went to France, to Germany, to see what is the world doing in terms of skills of the future. We, led by the president, were looking at the world of work, what is it informing our schools. So we really had hoped that the sixth administration will help us transform, which is what we're still doing under very difficult conditions. But yes, indeed, COVID-19 has also given us unique opportunities which we feel we should grab on. It has forced us to frog leap other programs that we had in place, like especially our ICTs in education. We were forced to really do some things differently, so that we're not reliant on the on the classroom, we're not reliant on just physical teaching. So there are things that we have begun to which we have gained from the COVID-19 disruptions, but the biggest disruption was to really throw us or shake us on the plans that we had as the sixth administration. We had hoped that we really have a new education system now, having, I think, the confidence that the system had begun to stabilize. And if you recall, we had less strikes, we had less stayaways. We really were stable as a system. We had begun to introduce more subjects, our pass rate was improving, and we were confident that now we can shake the system to another level, which I think has been disrupted. On banning of speaking own languages, Hope is looking at me that I should be politically correct. You see, I was a teacher also in township school, so you develop languages also, because sometimes English, and I'm not saying people should not be allowed to speak their language. I think it's wrong. Let me start off there. It's very wrong. Children should be free at school. You feel much better. You feel more confident speaking your language. And that's why we're even encouraging the pilot in the Eastern Cape of beginning even to teach children in their mother tongue. But I'm trying to think of what that these teachers, I'm not sure that they're just being malicious and being anti-African. It's to say the more you speak a language, the more you gain competency. Therefore, when you have an environment where you can speak the language, use it and don't. And I think perhaps that was a rationale. And what needs to happen is to remind those teachers to say people have the right to their languages. So even if they feel there's a way they want to improve their language competency, should not undermine their rights to their languages. Same with the hair matter. Just what the hair matter, we had addressed it. We had encouraged schools to revise their policies to make sure that, again, those policies don't undermine or disrespect the rights of children to even what is naturally their right to your kinky hair or other things. So that matter, if it's still persisting, we'll need to recommunicate, but we had our schools to streamline their education policies. On learning and teaching, for me today is actually one of the most important briefings that we have, because I never want to say crass, but I'm saying it's very serious. The challenges around learning and teaching are very serious. And if we don't find a way of containing them now, the consequences are dire. The fact that education system in the country is 12 years, it's not just a thumbsuck 12 years, it's because of what needs to happen in the 12 years. So if you lose a year, you lose two. It's really like losing your fingers in the process, which are going to have long-term effects. And that's why we have to work together, call our communities, that we have to work together to make sure that we can protect our children from further delays. We're monitoring learner dropout very seriously, because we know that if children have not been to school for a year or two, they get completely alienated from education. It's quite difficult to bring them back. So if they've not gone to school in 2020, they're not going to school 2021, it's going to be difficult to bring them back to the same grades 3 years down the line. So those are the serious challenges that we're confronting. As we correctly say, it has just brought lots of disorder. You know, 5 days helps kids to stabilize in the system. They come on Monday, they come a bit restless, they still have a weekend excitement, but by end of the day they have settled. You have them until Friday, they're settled, so you only have 2 days to disrupt. But if they're going to stay the whole week away from home, they come back a week after. It's very disruptive, even intellectual. That's why we're measuring teaching and learning to say we might have taught so much. The forgetting part, the disruptions, they've really brought serious instability to the sector. So it is a serious, something. It's very serious, these challenges that we're confronting. Around whether I think in the statement, maybe I didn't make it quite clearly, that we had reduced, health department allowed us to reduce from 1.5 to 1. That's why we're able to bring more learners. So we have reduced the spacing from 1.5 to 1 to a meter. It gave us some space. And in some schools, we're able to bring more learners in. In the school I visited, they were able to bring the foundation classes in, all of them, learners could come. But they were not able to bring the intermediate. They couldn't even have space beyond the 1 meter. The reason we didn't continue, because we had hoped that we'll get the 0.5 meter for the foundation phase to create more space. Because when they play at home, they play head to head. But the third wave discouraged us from even pursuing the 0.5 meter, because in these other areas, there's still high levels of infection. As much as children may not be seriously affected by infections, they can be carriers, and hence your infections in the Free State. So it may not be as serious in terms of leading to deaths like it does to adults who've got comorbidities, but it means a child in a highly infected area, like in the Free State, where the infections are high, they can bring the infection from school to adults. And that's why we felt that for now, let's allow the infections to drop and reconsider if, again, we can still negotiate reducing more spaces for your foundation phase. Because our biggest concerns actually is the foundation. You see, if we fail to get them right in their foundation, it's going to be difficult to get it right later. I always make an example with an adult who got educated, you know, the ones who corresponded, got their matrics, and the ones who started writing at the age of 6. It doesn't matter whether they come with PhDs and other things. You can still see from the handwriting that these people started writing later in their lives. Because the foundation phase, that's where you determine the foundation of your children's education. Their height, the size, like a house. The foundation determines your size and your height. Whether your house becomes double-storied, it depends on the foundation. So, of all the things that we really are hoping for, it's to be able to reach a stage where the foundation phase learners are able to return in full in classes. They're difficult to give homework, they're difficult to do other things, but they are key for any later success. So as I said, up to now, until now, I mean, I looked today, it was 10,000. So the infection rates are still too high for us even to consider going to health to say, please, can we reduce even further for the foundation phase learners? I don't know, or you refer to the Free State. The protocols are quite clear. We want to use a differentiated system so that you deal with the crisis where it exists. I mean, in the sector, we have more than 13 million learners. There is no way we're going to have 100% policy for 13 million learners on the basis of what happened to 80 or 100 learners, right? So if the infection rates are higher in the Free State, we deal with it where it is high, and the protocols are quite clear what you should do. But you can't, we've agreed that you can't just have one size fits all and just get everybody. If there's a crisis in the Free State, the whole sector has a crisis. No. If in Limpopo, like last time, there were 2 schools which had very serious infections, there are more than 5,000 schools. And people were saying to me, why don't you close schools? There are infections in Moria and this school. I said, but it's 2 schools out of 5,000 schools. Let's deal with those 2 schools. We closed them down. We really made sure that we worked with the committees, we worked with health and contained the situation where it erupts, so that we really don't disrupt everybody in this very challenging time. So we use protocols everywhere. So if the Free State there are infections, we focus on Free State where there are infections, not even the entire province. If there are high infections in the Western Cape, the taxi strikes, we know where it comes from. We're going to focus on that area. We're not going to focus on the whole Western Cape and even go to George where there's no infections, and really use the statistics that are from Southern Cape. So the protocols allow us to differentiate, and that's what we rely on. Teacher, I hope I've covered all of them.
Thank you, Minister. Are there any follow-up questions in the room first? Okay, there's one. We'll come back to that. Let me check the WhatsApp line first. Any questions?
Thanks, Mr. Motshekga. There's no further questions from WhatsApp line.
Oh, okay, great stuff. Thank you. Okay, we'll come back to the room.
Minister, just what's the progress with the education assistance and the general assistance? I know it also has to do with National Treasury, but what is the progress there, and are we likely to see them back in the schooling system? Thank you.
Okay, no, Cylinder law is now been activated as well.
Minister, I know you're paid to label this a crisis, but I mean, if you say that we have lost the gains from the past 20 years, we've lost almost 80% of teaching time just in this year alone. Where to from here? How does this education system recover? I know you called on stakeholders to assist, parents to assist, but the matrics who are coming in 10 years' time, what does that get to look like? For me, this looks like a crisis.
All right. Let me do one more check on the WhatsApp line. It looks like we'll not be coming back for the 3rd round. Okay, great stuff. Minister, I think this will be your last ascension to the stage. Thank you.
Okay. No, thanks again. Is it last week, DG, that we got the letter from Treasury that they will be giving us money for teacher assistants? Actually, tomorrow at 7 o'clock. We only got it last week. So we've been working, hoping that we will be giving and not giving up the system, letting our programs off. So the long and short, yes, we will. There's even discussions that we might even, so that we can sustain them. And in this program of recovery, try to use them much more tightly, comprehensively. There's indication that you can even be giving teacher assistance beyond a year, because it was disruptive. They say when we were just getting traction, getting momentum, we ran out of money because it was supposed to be a 3-month program. But the long and short, yes, we are going to get them. The numbers may not be, in any case, we may not need all of those numbers ourselves at a time. We might need to stretch them over in terms of the budget, but we're still working on the details. For me, it's not a crisis to call a challenge a crisis. So for me, it's a language issue. Because if you say a crisis, for me as a person, it just sounds like it's a very hopeless situation. There's, it's like you throw. So for me, it's a language issue. I call it a challenge because it gives me energy to say, yes, there are things that we can do. There are things that so it really, as I said, it's a language, just a concept. If you say crisis, it feels like we've reached the end of the road, we don't know what to do, we've thrown the hands in the air, and that's not how we view it as a sector. Maybe we didn't have enough time through the curriculum team to say what are the things that we are doing to try and manage. Because I said it's the unraveling, just to manage this unraveling that we're experiencing in this challenge. whether it's a crisis in this challenge. Maybe let's say crisis for not for peace sake, but just say crisis so that we don't have language issues. But as I say, we've trimmed the curriculum as part of dealing with the crisis that we find ourselves. We're having teacher assistants. We've really been begging Treasury to give us more money to get teachers assisted. Through teacher assistants, we are going to really do more work so that teachers are more focused on teaching, and then your teacher assistants can help with administration, can be trained on how to deal with learners, slow learners, but also can give psychosocial support. That's part of some of our responses. We have a whole menu which we didn't talk about around how we also are deploying ICTs, working with the Department of Communication. So there's a whole bouquet of interventions that we have here. We're strengthening our teaching learning materials in terms of textbooks. So it's a whole discussion that we can tell about what is it that we're trying to do to respond to the crisis, stroke challenges that are facing us. But it is a major matter of concerns, and that's why we really felt that we should really get this press conference, and we're going to start even having webinars to discuss more. As DG said, we received a report from the NECT, which is our partners. Even themselves needed to understand this crisis that we're in and how to deal with it systematically. And it was helpful for us to have done that, because some of the results were very, I would have guessed them differently. Your old rural schools, because they have lesser numbers, they've not been affected, they're fine. And it was for me quite a surprise that your schools, which were really, you expected them to be more in a crisis, were less of in a crisis. So we have that information. It also says, which is also, as DG is saying, very helpful and revealing that helpful that we did this study, that measuring teaching time is very different from measuring the learning that children have. So to look at their textbooks, to look at their work, to look at the assessment, to say teachers might have taught 5 chapters, but the level, the depth of understanding is not adequately deep, because teachers are trying to move fast to complete or to cover up on the curriculum. That has also helped us to say it doesn't have to rush too quickly, trying to chase time when there's no depth in terms of understanding. So those are the things, that's what this information is telling us, to say, now that we have this crisis, we have to do things differently from even our own understanding of how things get done. Yeah, so the crisis,
Okay, thank you, Minister. Thank you so much. Just 2 things from my side. The first one is on the EAs and GAs. There's a whole project plan that has been put together. Now that we've got the letter from Treasury, it's going to be processed. So the information will be made available at the right time once the Minister has finalized the processes that will unfold now that the letter has come from Treasury. So we know there's lots of questions that will come. When are we starting? Are you going to retain the same cohort that was there before, and all those questions? We don't have the answers to that right now. That's why the Minister says that we need to work through that letter, understand its true implications so that we can process it through the sector, and we'll communicate at the right time. That's the first thing. The second thing, the department has a WhatsApp line. It's called Teacher Connect. If you're a teacher or school principal, we urge you to please go there. The number is 060-060-3333. Just type connect. When you go there, you will get, there's a whole range of information that's available to you, but we would like you to please use it to report cases, COVID cases in schools. It will assist us as a department to know where the challenges are. In that way, we'll then be able to provide appropriate responses to deal with whatever issues that are emerging in terms of the risk-adjusted, differentiated strategy that we talk about in the sector. Those are the concluding remarks, Minister. We thank you so much for making the time. We hope that we'll be together again when the department has another media briefing. Thank you so much.
next?